So when we think of coronary circulation, we really need to think about blood supply to the heart. Coronary just refers to the heart, and circulation is just how the supply of that blood is in the heart. So we can divide the coronary circulation into two major parts. So we have the right coronary artery and then we have the left coronary artery. So right coronary artery basically supplies the right side, so right atrium and right ventricle, and left coronary artery supplies the base of aorta on the left side. I have an easy mnemonic that I learned from nursing school when you're learning about both right and left. So the mnemonic is I have a right to camp if you left off the AC. So basically, right refers to the right side. Camp, if you split it apart, CA is for coronary artery, M is for marginal artery, P is for posterior interventricular artery or called PDA, and left is for left of the AC. So AC is interior descending artery, which is also one of the uh, artery that if it gets damaged, there is a higher mortality and more damage to the heart. That's your LAD. And then we have our circumflex artery, which is called the LCX. So if we look at that, so the right coronary artery, as per the acronym, to the camp. So it supplies your right coronary artery, which sits at the base of aorta on the right side. We have a right marginal artery, which supplies the right ventricle and apex. And then we have our posterior intraventricular artery, which in 80 to 85% supplies that septum, interventricular septum. Similarly, when we look at the left coronary artery, it divides into left anterior descending artery, is also referred to as interior interventricular artery, left marginal artery, and circumflex artery. So the left anterior descending artery supplies the right ventricle, left ventricle, interventricular septum. Left marginal artery supplies the left ventricle. Circumflex supplies left atrium and left ventricle. It's really important for us to know which coronary artery feeds where and where the damage occurs. So, for example, your right coronary artery feeds the inferior wall of the heart. So, if there are changes in the ECG leads, the changes are in the second, third, and AVF of ECG leads. Your interior descending artery or your left anterior descending artery feeds the interior of the heart, which from the name you can tell like there's interior in the name, so it does feed the interior of the heart. And if there is a damage to this part of the artery, you will see changes in V1 to V4 in the ECG. And then your circumflex artery is kind of on the lateral side, so it does feel the lateral of the heart. So if there is a damage to this artery, you can see the changes in 1 lead AVL, V5, and V6. So that's kind of summarizes and easier to know because feeding of the coronary circulation is really important, and then you can see the management and things accordingly. Coronary sinus is, again, when you think of coronary circulation, we think of oxygenation, right? And we also need to think of deoxygenation. So coronary sinus kind of does that deoxygenation part where it drains the heart. So it drains by great cardiac vein, small cardiac vein, we have a middle cardiac vein and posterior cardiac vein. All of these veins drain into the right atrium, and this structure is located on the posterior aspect of the heart. So I hope you enjoy and just understand just kind of a basic summary of how the coronary circulation works.